Hello, everyone, and welcome to Team TSI's training today. This is a special training, and I can see just based on your response that it is really something that you're needing and you've made some time for, and we're all just humbled to have you here and that you're making the time to join us for a training. So before we get started, I want to go ahead and just do a little bit of housekeeping first. We want to make sure that you can ask questions, and on the screen here, you'll see that we've got the GoToWebinar panel. So if you can go and find your panel, some of you may have that panel collapsed, so it will look like that first little screen or that picture that I have on the screen. All you have to do is click on that little orange arrow. It will then open up and look like my number one screen. And there's actually two lines I want you to find today. If you can find the question line, and when you open the question line, it's going to look like my number two picture. And this is where you're going to type your question in. You would hit send. And when you hit send, it's going to appear up in this question box. And that's when all of us from Team TSI are ready to monitor and answer those questions while the training is happening. The other part I want to bring your attention to is the handouts. There are quite a few handouts, and we're so lucky to have the experts on today that have created some great lesson plans, some great resources for you to be able to take this into your facilities and make this actionable. So please make sure that you check those handouts because they are rather large, even though some of you may have no problem, others may have a little bit of problem, and our support team is on standby with these, ready to send them over to you if you're not able to download. So that would be support@teamtsi.com. And now I'd like to make some introductions. And behind the scenes, we have some amazing experts, and I don't have them all on the slide today. They are in the background assisting, ready to help with your questions, but we have a number of people behind the scenes, and I'm just the lucky one that gets to talk to you. But Greg Seipel and his team, Pat Newberry and Jill Pugh, they are part of the experts that are constantly working on the reports and all of the great things, especially in times of need like where we're at today. Along with those experts, we have people like Hugh Heaton that has been in the industry for so long and does so many amazing things for our industry. He is one of our consultant experts. And in a time like today, you're going to see where his resources are really going to come in handy. His knowledge is really going to, I think, jump off the page for you today, and it's going to be a great resource. So along with that, our support team, here's their information. So please feel free to reach out to our support team for anything if you have some additional questions after today's training or if you can't get those handouts. So with that, I'm going to go ahead and walk through what our session goals are today. And we're going to provide an overview of the PPE and hand hygiene practices. Now, it's not going to be some of your basic information. You're going to have the experts talking to you about why those are important, including the focus areas of infection control, focus survey process, the PPE utilization, the hand hygiene practices, training, education, and documentation of outcome, and resources and handouts. So with that, I would like to introduce our first expert, Greg Seipel. Thank you, Greg.
Thank you so much, Dahlia, and thank you to everybody who's on the call today. We truly, truly appreciate the time you're taking out for this training. We recognize the investment you're placing into caring for the population that you are, and the immense pressure that you're under in the midst of this national pandemic and state of emergency. So thank you so much for everything that you do and the time you're taking out for the training. I think we've all kind of seen with the pandemic and the way that things have been going, multiple releases coming out from so many different sources. If it's not a release that's coming out from CMS, something coming out from the CDC or the World Health Organization or even OSHA. with a whole lot of different information coming that is meant to complement each other, but it's sometimes very difficult to sort of slog through to find out exactly what is expected of me in this ever-changing landscape that is going on right now in long-term care. Just since March 9th alone, there have been 3 separate QSO letters that have been released. The first one on March 9th was related to the guidance for infection control and prevention for COVID-19. And that really was focusing on the visitor restrictions, how you're monitoring your staff, the PPE and availability of supplies, utilization in regards to that. And then that was quickly followed up the next day with another QSO letter related to guidance for use of certain respirators by healthcare personnel. That was expanding into industrial respirator usage, recognizing that there may be a shortfall in some equipment and different methodologies that we can use to keep, both of our staff and our residents safe. And then as recently as the 23rd of March, we had the QSO letter coming out for the prioritization of survey activities, where the focus was going to be really on a COVID-19 focused survey for nursing homes, really looking at sort of a protocol on how we were utilizing a lot of the standards that have been issued in the CDC guidelines and recommendations. We could do the next slide, please. So in this sort of evolving landscape that's been happening, the effectiveness of the infection prevention and control program is certainly going to be paramount. I believe that we can all probably recognize that the world has changed quite significantly, and this is definitely going to impact the survey process. The manner in which this pandemic has especially hit our industry, hit our nation, the sheltering in place. There's been a focus on infection control for a while now with regulatory changes, the advent of the antibiotic stewardship program, the infection preventionist, all the other kind of regulatory requirements that existed prior to this. But with the advent of the pandemic, there has truly been a massive increase in information coming out and new information coming out and new guidelines and materials. And the COVID-19 focus survey for nursing homes really is a big part of that, where they're really focusing on the overall effectiveness of your program. They're going to evaluate that overall effectiveness through not only reviewing policies and procedures, but looking at your standard and transmission-based precautions, which is really how you're effectively using your hand hygiene practices and your personal protective equipment. Those 3 areas are really the big crux of what's happening in that COVID-19 focus survey. There's additional things to look at, obviously, your training and education, your monitoring, your surveillance practices. That surveillance, many places have not truly extended surveillance to their staff before. And of course, that's added into this as well to ensure that you're monitoring your staff's health and well-being on a daily basis as they come to work. You're ensuring, your visitation and limiting group activities, all of that together, but really focused in on those 3 things: hand hygiene, personal protective equipment, your PPE, your standard transmission-based precautions. In the light of that, and in the light of those changes that are happening, we were blessed to have Hugh Heaton as part of our team, who had been putting together some of these training resources centering around this specific thing with the infection control practices as well as many other areas. And if you know Hugh Heaton, if you've ever utilized the Heaton manuals, sort of the gold standard for policies and procedure writing, one of the most brilliant people I've ever had the pleasure of working with. He has developed these training materials that will allow you to meet all of the requirements that are being specified in the focus survey for nursing homes for COVID-19. We're not going to go into the entire COVID-19 focus survey process. Those materials have been released: the user guide for the surveyors, education materials, a revised entrance worksheet. We are planning to host a training for that next week as well, once we have a chance to truly review the materials and get all of our ducks in a row. So please look for that coming as well as early as next week, to be able to kind of give you a broad or even a detailed overview of that entire process, how it's being designed to work, how much is going to be done off-site, what's going to be done on-site, the number of surveyors, new certain expectations in that process. But we really wanted to focus right now on those 3 elements: the hand hygiene, specifically hand hygiene and personal protective equipment. This is sort of your frontline defense against what's happening in your organizations or in your facilities to keep residents and staff safe. So with that introduction, I'm going to turn it over to Hugh Heaton. And thank you so much, Hugh, for joining us on this and the incredible work you've done on the training materials.
Thank you, Greg. Thank you, Dahlia, and for all that are attending. I first want to just to say I've spent 12 years as an administrator, and I had a lot of days that were stressful. But I can't imagine what you're going through every day. The workload, the stress. It's just amazing that you are able to continue to work the way you do. Thank you for all that you're doing, protecting the residents in your community and putting yourself in harm. I just can't imagine all that you go through. In working with Team TSI, we know that the survey process, even though we know that CMS has waived the CNA nursing aid requirements. We know that you're going to be able to hire people who are not certified, using volunteers and etc. And that in itself will help with the staffing. But the other side of that is it will have a tendency to create some situations that you normally would not have would be in. So, and looking at that, can you? I hope everyone can see my screen. Greg, do you see it?
Yes, sir, I do.
Okay, thanks. What I want to show you is there are two particular programs that's in the handouts. There's a personal protective equipment, and there's a hand hygiene. They are designed identically. They have three parts: the presentation slides, the participant handouts, and all of your support documentation. And what we tried to create is a program that you do not have to go out and create any other documents. So just walking through the material. Now, the handouts also include the PowerPoint slides. So you will have the actual PowerPoint slides. If you want to modify them to meet any particular requirement that your facility has, you can quickly modify the PowerPoint. So both of the PowerPoint slides are there, and they do have the instructor's notes with them. But as you go through, I'm gonna look at the beginning of the presentation. These are the presentation notes that has all of the information that is just real easy to follow. We know how busy you are, and we're trying to make this as a very easy process so that your staff can teach this quickly. It has 6 handouts. Everything in the programs are linked together. So if I need to look at handout number 2, which is a sequence for putting on hand hygiene, this is an actual CDC document. You can easily print it out on how to put on personal protective equipment. It's in English and Spanish. You could easily print this out, put it in the residence room, give it to your staff to be sure, especially new staff members, that they know how to do these things. So as you go through, every slide has notes to prompt the instructor. One of the things that we have added is that CDC has released guidelines on how to effectively use or optimize the supply of PPE. We know how important that is. So that information is a part of the program. It's in part 3. So if I need to get to part 3, there are all of the different letters. So as you go through each one of the slides, everything is ready, suggestions, how to move before you move to the next slide. Ask participants how important the use of personal protective equipment is to them. So you're going to find it extremely easy to use. When you get to the handouts, you have an overview of what the handouts are about and how you can use them. Handout number 1 is a duplicate of the PowerPoint slides. If you want to provide this to your participants, you can. It provides it's an exact duplicate of your slides. It doesn't have the teaching notes on it, but it provides a method for them to write notes if they want to. Go back to that overview. So each one of them providing information on when to use it, which slides it works with, and you'll find this extremely easy to follow. Any staff member that you have will be able to follow this. Any person on your staff can teach this. Handout numbers 5 and 6 are important. As Greg mentioned, they're looking at in the focus survey. While CMS has waived a lot of regulatory requirements, they have not waived the survey process. They are still going to survey the facilities. The focus survey, the COVID-19 survey that Greg was talking about, will be used for surveys with or without COVID-19 residents. What they're looking at is immediate jeopardy situations. Even when they come into the facility, they're going to look to see if any of especially in the infection control, hand hygiene, transmission-based precautions, and etc., personal protective equipment, they're looking to determine if any of those things have created or could potentially create a harm level deficiency. So even though they have waived some of your staffing requirements, you are still going to be responsible to be sure that staff member is competent in doing the training or doing the procedure. If you hire a volunteer to perform a procedure to help with resident care, you'll have to make sure that person can do the procedure. So 2 things that we've added to the process. The first one is a competency validation checklist. Extremely easy to use. It's a 1-page checklist. On this particular competency validation, this is a personal protective equipment. And it has 2 different, you can do how they did initially, or if it was necessary to repeat the procedure. But one of the things on this particular validation checklist is every one of these items are critical. They will need to actually demonstrate that they can effectively do that procedure. Did they fully cover the torso from the neck? But they're going to look at those things. So it's a real easy validation checklist, especially for new staff when you can train them very quickly. It's in the order when you put on the PPE. It's in the order that they would put it on, and the validation it's in the same order as you would take it off. So we want to make sure that you have the documentation that you need to support your compliance. The other thing that we added is a competency evaluation exam. This is a very easy exam. It's all true and false. There's 15 questions. Probably takes 10, 15 minutes to do the exam. But it follows the same order. These questions are in the exact same order as your slides are. So when you're looking at the answers, you're not going to have to go back and jump back and forth and say, I was on slide 8, now I'm on slide 15. So these are in the exact same order. Your support documentation is critical. These are all of the records that you will need to validate your compliance, that you can show the survey team. You have a record of in-service training. It's the questions of that you how was the what was the purpose of the session, and one of the things that's important in this particular document is this last question: comparative analysis. Was there an improvement in the staff's knowledge of the regulatory requirements governing personal protective equipment? And then how did you determine that? What the survey process is about today is if you had an in-service training program that addresses a particular problem area, what the survey team is looking for is what was the success of that training program and how did you validate that? And here we would look at things like your validation checklist. So that question is extremely important. You have your record of attendance. You have, if you want to use this, it's a participant evaluation form. It's not necessary, but it's there if you want to use it in the future when things calm down. But it also has a certificate of completion, and all of these forms can be easily printed so that you can use them just very easily. All of the CDC documents are here, and even an OSHA document on the use of respiratory fit testing. But I want to go back to the slides just for a moment and go down to the very last slide, and these are numbered, and you'll like that. The last slide is a question and answer session, and you really want to prompt your participants to ask questions. These are options using handout number 5, conduct a personal protective equipment. We just looked at that. That was handout number 6 is the training program. And then what I would recommend, what we see at this particular point is the results of those competency evaluations and the validation checklist. Use those results to modify your training program. Let those show you where the weaknesses are, and then focus on those areas. You may not have to retrain on everything. It may be just a couple of areas that you would need to train on. But to help with the answers, these are the answers to the exam. So we know, for example, question number 4, for example, eyeglasses are permitted to be used instead of goggles if there is a limited contact with the resident. So if I want to go back and look at that, so we know that the answer is false, but where is that information in the training material? It's on slide number 11. So all of that, all of your answers are there, and they're all linked. Or you can print this document out and you see it. The same program is true for your hand hygiene practices. It has some really good handouts, easy to follow. It also has a competency validation checklist. And you'll see in some of these, let me get it a little bit larger, you'll see where there's asterisks. Those are critical, and they have to perform those correctly. And the form explains all of that. It also has a competency evaluation exam, identical to the PPE. So when you download the data, be sure to download the PowerPoint as well, because you'll find the PowerPoint's extremely easy to use. Let me show you how it works. I'll have to change my display. So as you just scroll through it, it provides really helpful, and you can change those any way you need to. So if there's any questions, I'll be happy to try to answer some of them. We know how busy you are, and just wanted to walk through and show you how the programs are designed. They are designed exactly the same. There is a third one that we're working on that Greg mentioned, is the transmission-based precautions or isolation precautions. And we will hopefully have that ready for you within the next couple of weeks, and we'll post those so that you'll be able to get to them. They'll be designed the same way. So, Daya, that's all I have.
Thank you. Yes, we have received a couple questions so far. It's about the handouts, not able to download them, so we'll go ahead and send those over to some of you. There is one question for you, Hugh. On average, about how long does each in-service take?
I think you could probably do the in-service in less than 30 minutes. They're very easy to follow. Even if you provided someone with just the handout number one, which is the PowerPoint slides, they would be able to read those easily and understand what the material is about. The handouts will be helpful. It may be that you want to start out with the competency evaluation exam, do the exam, determine where your weaknesses are, and then train on those weaknesses. So you could even narrow it down to shorter time, because you may not have to train on everything.
Wonderful. And it does look like some of you are having trouble with the handouts. So I think what we'll do is, as soon as we get the attendee list, we'll go ahead and send out the handouts to those of you that have attended. So no problem. We apologize. We were afraid of that because they are rather large. And even when we send an email, we might have to send multiple emails because these amazing resources that Hugh's gone through are rather large. So we'll go ahead and get those over to you.
And this is Pat. I wonder, Hugh, one of the other questions that you might be able to answer is, will we be posting these in our library for those Team TSI users that can use the Team TSI library?
I think we had talked about creating a folder 19 for in-service training programs, and we can put them there, and we can certainly do that. And we can do that today.
Thank you.
All right. Well, we are getting thank yous. Great idea, Pat, and excellent resources. Everyone's really excited, Hugh and Greg, so thank you so much. Is the use of reusable gowns part of the training? So we just had that question come in, Hugh. Is the use of reusable...
Are these reusable?
No, the whole question is the use of reusable gowns part of the training, reusable gowns?
It will be. It is there, but it will probably be better addressed in the optimizing CDC guideline on the use of gowns. That particular CDC letter is there on optimizing the use of gowns. Most of these are talking about disposable. It does mention some, but it also sends you to that particular handout or that particular CDC guideline. And there's some good information in those optimization guidelines. Tremendous information.
And Hugh, some of the things that are coming in are just so awesome. I have to share with everybody. So thank you for your comments. Most people are just writing a lot of wonderful comments. One of them is this is the most helpful information I've seen so far since this started. Thank you so very much. So we are here with you, and this is awesome. I really appreciate it. Someone else just put, I just went to see if I had an email with the attachment, and I did not. So we'll go ahead and send that over to you if you have not received it yet. The attachments may be a little bit large, so we might have to separate them out and send you a couple different ones. So that's probably why you haven't received it yet. So we'll resend and we'll separate the information. So thank you so much.
The PPE is the largest. It's about 9 megabytes. The hand hygiene is about 2, and the PPE and the PowerPoints are not very large. But the PPE is so critical that it had to be larger than we had wanted, because there's some really good handouts in there, tremendous handouts in the PPE training program.
So thank you so much. I think what we'll do is we'll send out one email with just the large PPE to everyone, and then we'll then send a second email with the smaller ones attached. And we'll test out a couple of you first, and if you can confirm that you've received it, then we'll go ahead and send it to everybody. So thank you. All right. Well, your time is valuable, and we really appreciate you spending your time with us. Greg and Hugh and Pat and Jill, is there anything else you'd like to share?
I don't have anything.
Just everybody, please be safe. Practice as safely as you can. We will all get through this together. I just want to, again, thank Hugh for putting this information together. Not only just putting the information together, but providing it basically openly, almost as a public service. Not everybody has access to training materials, of this nature, and all the pieces that go along with it that are designed to keep you compliant, not only with the regulations, but hopefully practicing safely. PowerPoint presentations, all the information is there, the information for the presenter, more of a facilitator guide, the recipient and participant, having all that available to them, the handouts, all of it organized together so well. So just thank you, Hugh, so very much for assisting our clients and even our non-clients with this information.
Well, I appreciate that, Greg, and we're all in this together. This is a profession that I've enjoyed over 40 years, and I want all of us to do what we can to help the facilities stay compliant and take care of their families and their residents. That's the main goal.
Absolutely, and please be safe out there, everybody, and let us know if there's anything Team TSI can do to help you. We know that you're busy, and we all are in this together.
All right. Well, with that, thank you so much, everybody, and we will be following up with these handouts. And thank you so much. We'll also be on the lookout. We are putting together the dates, looking at next week for another training that Hugh and Greg are putting together as they discussed on infection control. So it will be very similar to today's. We'll have some handouts and we'll walk through specific items, and it will, hopefully go out either today or tomorrow. So thank you, everybody. Stay safe.
Thank you.
Bye-bye.
Bye-bye.